And I think especially being on a trial, and there hasn't been a quick fix to my cancer. So it's not a case of let's remove it and get rid of it. It's actually been a real journey. And I still have cancer and I still have an active tumour. And I think I'm just very aware that I'm lucky to have the time that I've got.
How do you guys know each other?
You start.
I was referred to the Royal Marsden last January, where was it January?
It's January.
Oh, it's January. And I was introduced to Lauren, who was potentially going to be my nurse on the clinical trial that I was going to go for. So Lauren helped me decide if I wanted to do the clinical trial. You told me all the information and you were like my port of call.
The first question is the same for both of you. So what's one moment in this whole journey together that you'll never forget?
You're looking at me weird.
I would say...
It's probably the same thing, isn't it?
When you cut my hair.
Yeah,
Yeah.
shaved your hair.
Yeah, my hair started to fall out and I was in hospital at the time, wasn't I? And I didn't want to lose it, but I didn't want to watch it fall out. But you stayed behind after your shift. So you'd done your shift and then you came back in once you'd finished work. And then we set up a camera and then we shaved my hair, didn't we? I don't know if we've done a good job, but it went.
I think we did a great job.
Yeah, true.
Fantastic job.
I mean, I wore a hat after, it was fine.
There was so much hair everywhere, wasn't there?
So much hair, yeah.
All over the floor. What's something I do that always makes you feel at ease?
Oh, just being there.
Oh,
Yeah.
so sweet.
Because every time like I email you a really random question,
Yeah.
you always answer straight away. But you're always there. Like if I need you, you're there. And it doesn't take you very long to get back to me. And I think that's the most reassuring thing that you do, is just knowing that you're there. I don't think you get that everywhere.
Oh, that's really sweet.
I know, isn't it? But it's true. I don't know if you get that in most hospitals where you've got such a direct kind of line to your nurse. And yeah, even if it's so irrelevant.
There's been a few.
Yeah, there's been a few. I'm just not sure. But you'll always answer. You'll always answer. And I think that's really nice.
Has this experience of dealing with cancer changed how you see your life, and how so?
Yeah, massively. I think when I was first diagnosed with cancer, I was 36, so I was quite young. I think that changes you. I think that changes everything. It changes your whole aspect, and suddenly the dramas that you had previously aren't relevant.
So relevant.
They're really irrelevant.
Who's eating the butter?
Yeah,
you know?
or someone's got a cold and you think, oh no, you're all right. And I think it's changed my perspective on that. Like I'm very much, let's live life, let's go on holiday, let's do all the fun things, because you just don't know. And I think especially being on a trial, and there hasn't been a quick fix to my cancer. So it's not a case of let's remove it and get rid of it. It's actually been a real journey. And I still have cancer and I still have an active tumour. And I think I'm just very aware that I'm lucky to have the time that I've got. And hopefully it continues. But yeah, I think it's definitely changed the way I think.
Long may it continue.
Yeah, it will. It will. But definitely, especially with the kids as well. They're so young still, and I want to spend time with them and I want to have fun with them, and I don't want them to remember me moaning to clean their rooms. I'd rather they remembered us going on holiday. I'd like to say I'm more relaxed, but I don't think they'd agree. I've had a long time to get to grips with it and I've had a long time to live with it. But I get my moments where it still hits me and I think, oh my God, I've got cancer. Because sometimes you just forget.
Yeah, and you're then like, oh, I'm going for a scan next week. Oh.
Yeah, or you'll do something, or you'll fill out a form and they're like, do you have any illnesses? I'm like, oh yeah, I know I do. I have cancer. And I think it's really hard the last 3 years for it to not define me.
Yeah.
Because it has become my identity a little bit. Like I'm Jenny who has cancer, or people have just met me in the last 3 years. That's all they know. They haven't seen like me before, which is really tough because you think, oh, that's not me. Like this doesn't define my personality or who I am. So I find that really hard.
What has your experience been like being treated at the Royal Marsden? So what's the trial you're on?
So the trial I'm on is the IL-2 trial. Is that right? No. What am I on? I'm on the TILS trial.
TILS trial.
Do I go in
Do
depth?
you want me to go in depth for you?
You go into the medical side of it. 'Cause
Yeah,
you're
and then
better
you
at
can
that.
do the experience of it.
Yeah.
So Jenny's trial combines immunotherapy with TILS treatment. TILS treatment stands for Tumor-Infiltrating Lymphocytes.
Yes, it does.
And this means that we went into theatre, so we took Jenny for her surgery, took out some of her tumours in the lymph nodes. In theatre, we chop them up into small little pieces while she's on the theatre bed. And then we send them off to America. They get extrapolated up. All the immune cells that have found that cancer would therefore be able to detect the cancer in Jenny's body, is the research behind it.
Yeah.
It's then grown for about 4 or 5 weeks in America. You're given a week of really intensive lymphodepletion chemo, which is why you lost your hair, to kill all the competing immune cells. And then we give this TILS treatment.
Yeah.
Therefore, we've kind of strapped away everything we don't want. We're giving her all the good stuff that's recognised the cancer. And then we give another drug over 3 days that intensifies that and gets the immune cells to work.
Basically rebooted me, didn't you?
Yeah.
You took me down to 0 and then rebooted me back
Yeah.
up with these new, healthy, lovely cells.
Hopefully, which
Which
found
are-
the cancer.
But seem to be working at the
Seem to be
moment.
working.
My tumour was quite large. It was 6.5 centimetres and now we're down to 3.5. So it's shrinking.
Yeah.
It's really working. Someone said to me, I was like, oh, you've had a perm. I was like, no.
No. Where do I start the conversation about my hair?
It was someone I hadn't seen for ages, and she was walking her dog, and she went, "Oh my God, you've had your hair cut really short and had it permed." I was like, "Oh no, I haven't."
No, I was bald for 6 months.
I
But
was-
thank you.
Yeah, thanks.
Great.
It's really hard. It is hard. It is hard to lose that identity. But in the same breath, I think when I do become cancer-free in the future, what's my identity going to be?
Yeah, I know.
I'm going to
yeah.
be lost, because this has been such a big part of my life, of my whole family's life. It's been
Exactly.
massive for everyone. And we've all adapted and kind of got used to it. So yeah, it's been a long 3 years. It's hard. It is hard. I do have ups and downs.
You're allowed to.
Yeah, I know. I think it's been an emotional roller coaster as well, because I had cancer. So
Yeah.
first thing you think when you get diagnosed with cancer is you think, I'm going to die.
Yeah.
And that's all you can get, and you can't get it out of your head. No matter what anyone says, it's in there, and you think, oh no, I could die. But then I got the all clear, and I was all clear for four whole months.
Yeah.
And I thought, oh, I'm fine. But then obviously I found the lumps, and then we went again. So I think it's just been that up and down and up and down, that
it's a roller
you're trying to
coaster.
catch up with yourself. Because I'll look back and think, God, I've been through a lot. But at the time you go through it because you have to.
Just deal with it, don't
Yeah,
you?
you just do it. But you just keep thinking that there's a reason we're doing it.
Yeah.
And if it means that I've got another 30 years, then you got to do it.
You got to do it.
I'd do it again. 100%. If I had to. I don't want to. If I had to, I'd do it again. What's the emotional side of your job that people don't see?
Oh, too much.
Yeah.
It's not a job where you leave at the door. You spend your whole Christmas worrying about someone's scam result. And if it's not good, you then think, I'm going to have to tell them after Christmas. Or even if it is good, you think, oh, they just want to get it before Christmas. Like, Christmas is such a big thing for all our patients. You always have some sad cases, obviously. And you just can't leave it at the door, so you go home thinking about it. I mean, 3 out of 5 days I won't think about things, and I'll very much go for a run or shut it off. But there's always 2 days where people are really struggling, and then you go to bed, you wake up at 3 a.m. thinking, oh, I haven't done that, I haven't done this, I haven't done that.
Yeah. But I always forget that you've got other patients.
You always say that, don't you?
Yeah.
I
feel
always talk.
if she talks to someone else, I'm not, who are you talking to?
But it's very emotional. I think it gets harder and harder when you know the patients, you know their husbands, you know their wives, you know their daughter's birthday, you know their son's birthday, you know they're finishing school, you know they're getting their GCSE results, you know everything about someone's life. And I've always been very much an intense person. So I'll be like, oh, tell me all about your family. I need to know everything. But then that's also so hard when things are someone's getting married and they're not going to make the wedding because they're quite poorly.
No, I think that's a good thing. I think we need that. As patients, I think we need that. I think that's a really good trait to have.
Good.
How do you manage the emotional impact of your role in your personal life?
I have very good friends, very good family, very supportive. I don't tend to talk much about work. So sometimes you just find yourself being quite surface level about work, and people will be like, how's work been today? And I'll be like, yeah, it's fine. Because they don't really get it.
Yeah.
And sometimes I'll go a bit deeper with maybe my parents or my sister or something like that. But I don't tend to talk to my friends about it, but I just tend to plan stuff. So like I'll always be doing stuff, either like running with a friend or like going out for dinner or going to theatre or like seeing friends all the time. Like just keep yourself busy.
Light-hearted things as well.
Yeah, just like live your life. And I'm in my 30s. Got to enjoy myself.
You've got to.
A little side question from me, like how does it change your perspective on life? Like,
oh, I do not sweat any teeny weeny small thing in life. I don't have time. I don't sweat if I don't like an outfit. I don't sweat how I look particularly. It's all irrelevant. Like the most relevant things in life is your interactions and what you can do for other people and what you can do for your friends and family. And I've always been taught very strong work ethic. Like you're good at your job, you put everything in, you're a good member of the family, you're always there for your family, always there for your friends. And you just don't sweat the menial things that are so irrelevant.
what does it mean to you to work at the Royal Marsden, like personally?
I suppose it's everything. It's my whole life. I do have a life outside of work, just to clarify for the video. Very good life outside of work. But I love it. I love my job. I love coming into work. There's not one day that I sweat coming into work. There's not one day that I wouldn't want to be here. We all have hard times, of course, but I love my job. I love my team. The team I work with are fantastic. My manager's amazing, so supportive. The consultants we've got on the team are amazing. So we're just so lucky that we're also research focused and we're also pro patients. I know that's an obvious thing to say, but we are very patient focused in our team. And the patient always comes first. If the trial's not right for them, we don't need stats. Yeah. We always focus on the patient. So it means a lot. It means everything to me. What does person-centred care mean to you?
It means everything to me. It means that I'm a priority. I feel like I'm your priority. I feel like we've said, like you're there if I need you. I feel like I'm important and I'm not just a number. And that's really, really important, actually, because sometimes you can just feel like a number. Or like you said, if you're on a trial, you can feel like you're just going through the motions. Yeah. Whereas you guys are very much, if it wasn't right for me, I wouldn't do it. Yeah. Or if it didn't fit in with my family life or it didn't fit in with me at all, then you would just pull the plug and say, this isn't right.
If you could describe our journey in one word. Our journey. It sounds like we're getting married.
We are.
Our journey. I feel like it's much more your journey than my journey, so I feel bad jumping on this bandwagon.
I wouldn't have a journey if you weren't in it, really.
If you could describe our journey in one word, what would it be and why? I would say for our journey, crazy.
I think I've already said. I think mine's a roller coaster. It's definitely a roller coaster. I don't know how else I'd sum it up. There's highs and lows and all sorts going on. Oh, are you ready? What have we learned from each other?
I learn a different thing from each patient, but the main thing to take back from everyone, including you, Jenny, is that you just have to live your life and you have to have no regrets. Yeah. You don't get the time back. Past is the past.
No, and I've learned from you, compassion is key, I think, because no matter what job you're in, if you're not passionate about it, then it's not for you, whereas you are passionate about your job and you do genuinely care. And I think that's really important, especially when you're working with cancer. Should we be careful of my arms? They're really sore. No. Thank you. Oh. Don't cry.